Well, hello, this is Dr. Amigues, your friendly rheumatologist, for another Rheumatology 101, where we talk rheumatology. And today we're going to talk about remission. As you may have seen, I recently had a rant about a comment on YouTube where a patient said, well, if my with my physician were to say that she is offering remission, then I would walk away. And it really upset me, as you can see, since I'm talking about it again, because that's actually the recommendation of the American College of Rheumatology. It's also the recommendation of ULAR, which is the equivalent in Europe. And it also made me realize that we are not doing a good job at educating our patients in rheumatology. And I wonder if one of the reasons this is happening is because when it comes to care in America, there is this idea that if maybe, I don't know, it's just an hypothesis where basically the physician is afraid that the patient is going to come after them because, maybe they didn't reach remission or whatever. And so I want to be clear that one, those are the recommendation. If you have rheumatoid arthritis, if you have psoriatic arthritis, if you have gout, if you have anything sort of inflammatory, our goal is remission, vasculitis, and so on. Why? Because we know, one, because we have options. So that's number one. Two, because we know that there's a window of opportunity. We know it in adult onset Still's disease. We know it in rheumatoid arthritis. It's probably the case in psoriatic arthritis and so on. So that's number one, is that we know that the faster we get you to remission, the longer you're going to stay in remission and the deeper the remission state will be. So that's number one. Number two, we have a ton of options. So we can't, maybe like 15 years ago, we couldn't say, well, our goal is remission because we had just, one biologic. Now we have many. So I think that that's important. And then the third thing is that, the goal is remission so that then we can back off. And so I think that that's important because very often when I see patients that come into the practice, they think, oh, you're talking about medication. What they don't realize necessarily, until I explain, of course, is that the goal is full remission, get the fire away. I really see it as a fire, and then we back off. Once you're in full remission, deep remission, then we slowly back off so that you're left with the least amount of immunosuppression possible. And this one is really hard to study because it's very individual based. So while it's, kind of quote unquote easy to study the response to treatment, it's less easy to study backing off from treatment. And also, like, what are the patients doing in addition? Are they doing an anti-inflammatory diet? Are they working on their mindset and so on? So this is something that's very individual. And this is just as important as getting into remission. How do we get into remission? There's several things that in my practice we do. The first thing is to have a proper diagnosis. You wouldn't know the number of time when a patient comes in, has been diagnosed with maybe it's, I don't know, I think I had seen, like, what's the last one? The last one had been diagnosed with rheumatoid arthritis, but when you're looking at her, like, behind the ears, she had psoriasis. So it was psoriatic arthritis. Another one had been diagnosed with lupus, but really she had psoriatic arthritis also. Another one had been diagnosed with pseudo gout, but really it was rheumatoid arthritis. Someone had been diagnosed with rheumatoid arthritis, but there was also pseudo gout. It's really, really, really important to think, what is this diagnosis? What's happening is very often, because some of the practices don't have the time, they make a diagnosis on the easiest way. So maybe it's like, you have a rheumatoid factor, so you have rheumatoid arthritis, but a rheumatoid factor is not specific to rheumatoid arthritis. You can have a rheumatoid fracture for many reasons. And so we have to take the time to figure out if this is the right diagnosis or if there's something associated with it. Because if you have an autoimmune disorder, you may have 2 or 3 or 4, right? I mean, I don't think well, actually, yeah, no, I have seen 4. But, it's basically what we call overlap syndrome. And that is really important because let's say you have rheumatoid arthritis and secondary Sjogren. You can treat the rheumatoid arthritis very well. The Sjogren is a little harder to treat, and it's not going to be treated with the same thing. And so we have to set the expectations very early on of, look, rheumatoid arthritis, it's an inflammatory arthritis, we can take care of it. Sjogren, we can take care of the inflammatory arthritis. The small fibers neuropathy or the fibromyalgia associated with this, that's a little harder to treat, and it doesn't take it's not exactly the same pathway that we're taking to take care of that. Okay, so that's the second thing, which is super important, is 1, is this the correct diagnosis? 2, is there an associated diagnosis with it? Like, for example, rheumatoid arthritis and osteoarthritis. That's that can be tricky. But again, setting the expectations of, look, the pain that you have in the morning, we can take care of it. We can get to remission. The pain that's basically because of destruction of your joint, and that's led to osteoarthritis, that's a mechanical joint pain. That's more when you're using them more at the end of the day. That one is much harder to get into remission, right? So that's really, really, really important. And then it's the proper treatment, right? So is this the correct diagnosis? Number 1. Number 2, is there an associated condition with it? Number 2, what is the best treatment for this? In terms of treatment, there are several things to take care of. Number 1 is, what have you tried before? What makes the most sense for your condition? So, for example, if you have one condition, great, that's almost easy, right? Are you very inflammatory? Is this something that we want to treat? Then basically we're looking at your presentation. What is the presentation you have? If you have lupus and you mostly have joint pain and skin issues, then it's you don't need as much as someone that has renal disease. And that's really, really important to realize that, because again, if you have a fire, you want to take care of it with a bucket of water. But the amount of water that you're going to put on a fire, it really depends on how much fire you have. And that's pretty much how we deal with this, right? And the second thing is, what have you tried? Have you had any complications or side effects? And then has there anything that has actually helped you? Basically, let's say you've tried an anti-IL-1, such as anakinra, and you definitely saw some improvement, but just not perfect. Well, that tells us something, right? Because then you may have tried other ones, didn't work at all, but then the IL-1 inhibition is probably where we want to go with just maybe more anakinra, right? Like more IL-1 inhibition. So that's also super important to realize, is what type of treatment have you gotten and why did you stop it? And then personally, one of the things that I love doing, and I'm really happy that I was able to create this practice to do this, is when someone cannot reach remission and they've tried multiple treatments and we figure out their diagnosis, this is good, but then they have complication after complication or side effect, or, from the medications. This is, I think, one of my zone of genius, honestly, where the idea is to go really deep and figuring out what are the benefits for not getting into full remission. The other day, I had a patient where I talked about this. I talked with them about this. And I asked that question, which is, and it's a really good question, and I'm highly recommending you think about it. What are the positive points of having your rheumatology condition? And so probably your first reaction is like, are you crazy? There's nothing I cannot see. If you are thinking I cannot see anything, then that means that there's a big one. And so you have to think about it really deeply. And so it's a fun exercise. I mean, it's not necessarily fun, but it's, you have to treat it as a fun exercise of, well, what has this brought to me so far? So a big one that I see in my patient is that it's brought me closer to my family. It's made me realize what I really wanted in life. I'm okay. This one is a tricky one, but I'm proving that Western medicine doesn't work. That's a really important and tricky one, especially on the other hand of that, because then as a physician, I have to like basically figure out how to make sure that they are trusting, right? And to make sure that their values are in, that they have a value of getting into remission. And the second, so those are like just some examples, right? But like, what is it for you? What is positive from this? And really the cool thing about responding to this question is that it doesn't just help to get into remission, because again, getting, side effect from medication tells us something. Not everyone gets a side effect. And it's actually really interesting if you think about it. We don't actually know who does side effect from what, right? There are genetic components for some medications, but very often you can't plan. You cannot know who's going to have a side effect. And very often the patient comes and they have this idea in their head of, I'm special, side effects happen to me all the time. And they usually read the side effect list and they will make it happen, right? And so we need to work on what does safety looks like. What does it look like for you to be in remission? What does it look like for you to have a body that accepts this medication? So the first question again is, what positive are coming from the condition, the disease? The second question is, what would you miss if you were to reach remission? And that's probably my most interesting question, is because those are actually two different questions. What have you gotten from getting a condition? And the second is, what would you miss? And your first reaction is going to be nothing. That's all I want. But then think about it really, really clearly. I'm going to tell you my own, right? So when I was dealing with the stage 4 cancer, somehow everyone was so kind. Everyone was very supportive. I could work as much or as little as I wanted. It wasn't a problem. I could say yes or no to whoever I wanted to see in terms of patients. And right. And going into remission meant that I wasn't necessarily going to have this support. And that's when, because I saw it, and I saw this before I reached remission, I was like, whether I reach remission or not, I will make sure that this continues to be something that's important to me and that I continue to do this. I will not get burnt out. And it's that's one of the reasons I opened on UnabridgedMD, is because I said, I want to be the best version of myself always. And this condition has taught me what was important to me. And this is important to me. Time is important to me. And I will make sure. And I will make sure that I have it. Time to see my patients, time to get my patients to remission, time to spend with my family and my friends, time to spend on me. And it's not selfish. It's literally my values. And some people will, find it selfish, but I want to say, look at this. What do you mean by it's selfish? Like, if your first reaction is this is selfish, look at it, because that means that there's something about you that is actually very inspired or jealous, or, if you're like really upset about someone like me that takes time for me, then think about like, what does that mean to you? Why do you have this? Like, why do you have this feeling? What are the positive of this? What are the negative of this? Right? So yeah, those are, some of the things that we do to get patients into remission. Once we look at this, we have techniques of visualization, affirmations to get there. And of course, I'm around, and so I'm available. And that's, pretty much a pathway to get to remission. And I highly recommend it, because it's not a question of if you deserve or you do not deserve. It's a question of those are the recommendations. There is recommendation to go into full remission in rheumatology and inflammatory arthritis. So you can get it. Okay. All right. Wow, that was serious. Hopefully, I didn't lose anyone. I see some people are watching live. It's a pleasure. And Predator, hi. And your question is, what natural treatments are for arthritis? Well, if you're talking about inflammatory arthritis, there's, or even osteoarthritis, there's turmeric or curcumin that is a good natural treatment. There's a small randomized controlled trial in osteoarthritis, again, placebo, that showed that it actually could help. So I would recommend that. And then honestly, natural treatments for me, I'm not a huge fan of supplementation. I think that things should come from the food. And so I'm a big fan of having a healthy, whole food, plant-based diet. Organic if you can afford it. But again, like, it's a question of investing in your health. So personally, I used to not eat organic until, I got diagnosed with stage 4 cancer. And then I was like, okay, that's it. Just organic for me, because it's worth it for me. The second is no processed food. So you want whole food. You want the ones that you're making from home, like you're cooking the vegetables, you're cooking the grains. That's whole food. And and try to have, like, I think of taking more of rather than thinking I'm removing stuff. So add veggies green, the ones that are bright, because they are full of antioxidants. Add this in your diet, nutrition choice. And then once you start with this, you will see that you will eat less of over processed food. If you start with produce, and if you start with the produce section, you will see that you don't need as much packaged food. So that's really important. Honestly, if you're in Europe and you have access, or like in South America or whatever, if you have access to market, or I think California has this. In Colorado, they are not the greatest. Honestly, I'm going to be honest. I find that it's actually a lot of processed food in markets, but the open air markets usually have a lot of produce. If you go there, you have more chance of actually getting food that is probably very good for you. Okay. And it's also fun to do that, I think. Maybe that's the French. So those are some things. So turmeric and ginger. Sorry, ginger is also anti-inflammatory. I don't think there is any study on ginger, but my patients really recommend it. And then the last thing I forgot to say. This is painful for a French person to say, but gluten seems to cause a ton of inflammation in this country. At least I think it's happening also in France, to be honest, but in this country, definitely. So gluten and dairy. I wonder if it's because it changes the microbiome, because it's so processed that it changes the microbiome of your guts, and that leads to inflammation. But there is a link between the microbiome guts and arthritis. And so I do recommend that. So again, if you don't want to restrict yourself, think whole food, plant-based, grains, beans, right? So chickpeas, green beans, beans, I think that's called beans, and maybe black or dark rice, so that it's not the white rice is actually processed. You don't want bleached rice, you want the dark rice or the brown rice, and quinoa, injera, which is the bread-like thing that you eat in Ethiopian restaurant, that can be gluten-free. It's super good. I love it. That's this, and then a ton of veggies, and then a couple of fruits. And in terms of you can have mushrooms, and you can have, I'm just thinking a little bit of fish as well. I try to stay away from meat because I think it's pro-inflammatory. I think it's there's a lot of antibiotics in those meats, and I don't want to wreck my gut, basically. And sometimes I do eat meat, but then it's like the most incredible meat ever. So that's what I do. But yeah, so if you're watching this on like live, I forgot to ask you to hashtag like we're about to stop, but if you're watching this on replay, hashtag replay, share this with a friend. I'm sure someone needs to hear those words. Share it with them. And I'm seeing patients always in rheumatology in Denver. We are actually expanding. We are also now seeing patients in Boulder. And I have started coaching, medical coaching, if anyone is interested outside of Colorado. It's a pleasure to see you as always. I will see you next week. Have a great week. Thank you very much, everyone. Bye-bye.